Hello, everyone. I'm Alexandra Galarza, and I will be presenting on Chapter 14, Counseling and Therapy in Groups. When it comes to counseling and therapy groups, group counseling and therapy can often be the most difficult, but also the most rewarding type of counseling and therapy to conduct. Chapter 14 does an in-depth dive into group counseling and therapy and what it consists of. To begin with, let's talk about the goals of therapy groups. Goals of therapy groups. There are outcome goals. Outcome goals are goals that pertain to behavior changes in the member's life. An example of this is obtaining employment, improving a relationship, and maintaining sobriety. Process goals. Process goals refers to goals that are related to the group's process. An example of this is increase in openness within the group and improve of comfort level within the group. Now, establishing a group is a process in itself. So, establishing group size and membership of therapy groups. Ideal therapy groups. Ideal therapy groups consist of 5 to 8 members, with the memberships remaining constant. Ideal therapy members, group members attend voluntarily and are open to share. Ideal therapy group settings are usually colleges, private practices, schools, mental health centers. There are also less than ideal groups. Less than ideal groups have forced attendance, are large groups with ever-changing members, and not everyone participates. Usually, these less than ideal groups are held in crisis centers, drug abuse agencies, and prisons. Places like these usually have less than ideal groups because the attendance is usually forced and it's usually large groups and the members are changing constantly. It is also important to screen members. Screening members. Screening members is important because some members may be too emotionally unbalanced and would do better with individual therapy. Finding members with similar issues so that the group connection can be made is very important. Screening is helpful in getting the right mix of members so that the group can be successful. When to meet. There is no specific number of times to meet or schedule. The counselor should try various meeting schedules to determine what is the best fit for the group. As the counselor, therapist, or leader, it's important to know your role. The leader's role and responsibility in therapy groups. The 6 responsibilities. 1. Know the subject or topic. It is important that the leader knows the subject or topic that they will be discussing in the group very well in order to lead the group successfully. 2. Providing the right atmosphere. It's important that the leader provide the right atmosphere so that the participants and members feel welcome and are in the right environment for them to share. 3. Directing the focus. As a leader, it is important that you are the person directing the focus within the group. 4. Being aware of individual members. As stated in the previous slide about screening members, it's important to be aware of individual members and their needs. 5. Watching the clock. As a leader, you need to watch the clock to make sure you don't go over the time allotted. And 6. Apportioning the airtime. This means that you have to ensure that all members get the same airtime for them to share or speak. When conducting group therapy, it's vital to ensure members are getting the most of their therapy sessions. Counselor must find ways to getting, holding, and deepening the focus. To do this, the leader can introduce the topic to start the conversation. Make comments and ask thought-provoking questions to the members. Shift the focus if it goes astray. It's important for the leader to shift the focus if the topic goes astray. Obtain contract If the focus is going to be on a specific individual, make sure the client is okay, the focus is on them. An example of this would be if you feel one of the members needs that extra time to work on a certain issue, you have to make sure they are okay with the focus being on them. So an example would be asking the member, if we work with you on this issue for 20 minutes, would that be helpful? And if the member says yes, then you have obtained contract, and that means you can focus on that specific member. Always bring it back so it stays on topic. Again, it is very important while leading a group that you stay on topic. Participation is important for success in group therapy and counseling. Techniques for engaging members. You can ask the members to ask questions, ask the members to guess what the problem is, and also ask the members to role play. These are all techniques to get the members involved and engaged. When conducting therapy groups, there's also the use of therapeutic rounds. One of the therapeutic rounds is in-depth stationary rounds, a round where the working member says something to each member of the group while remaining in their seat by going in a round. First type is each member makes the same statement to each member and they go in a circle. Second type, members turn to one another and complete the same sentence stem. Third type, member each responds to the repeated question from another member. And fourth type, each member asks a questions to the working member. These are ways to use the group and around to make sure everyone participates and everybody stays on topic. There is also in-depth movement round. In contrast to the in-depth stationary round, the in-depth movement round involves the members moving in front of each other and the members thus intensifying the experience. This promotes in-depth exploration, intensive feelings, intense atmosphere, and breakthrough. So with in-depth movement rounds, you're actually making the members move around, facing each other, get in front of each other. So this creates a more of an in-depth exploration and can lead to breakthroughs and intensive feelings. As a counselor or leaders, we also have to be careful not to make the following mistakes when leading groups. Common mistakes made when leading therapy groups. Attempting to conduct therapy without contract. As we stated in some previous slides, it's important to get contracts from the members to make sure they're okay with participating and sharing. Not involving other members. When conducting group therapy, it's important that each member gets to participate and everybody is involved. Spending too much time on one person. It's also important as a leader to make sure that you don't spend too much time on one person. It's also important not to spend too little time on one person. You have to make sure that all members are equally balanced and that everyone gets to share. Focusing on irrelevant topic. Again, sometimes when leading a group is hard and obviously the focus can go astray, and sometimes it can lead up to topics that are irrelevant to what the group is there to talk about. So it's important to refocus the group, letting members rescue each other. So this can be a mistake also since some members want to take the lead and you shouldn't let that happen. You as a leader need to make sure that you are the leader and that no other member tries to run the group. Letting the session become an advice-giving session. Oftentimes in a group, there are many opinions and advice can be shared, but it's also important that the group does not just become an advice-giving session and that it always comes back to the topic and what is set to be talked about at hand. So to conclude, leading group therapy can be intimidated, but by following some basic steps, it can really be a success. Thank you so much. This has been Chapter 14, Counseling and Therapy in Groups. Thank you.